Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we face problems in the healthcare system and then try and make a better system for all of us by taking actions. Before we get started talking about Trump's attack on healthcare, one of many, and childhood vaccinations, where we have problems, down below in the YouTube description box, you'll find a link for the Healthcare Advocacy newsletter. That is the text for today's video. You can go there, subscribe for free, get it delivered to your inbox most every day, most every weekday. It has all of the links and background material and links to news stories, as well as a host of good reference material that you may find valuable. So let's start. Childhood vaccinations, not good. Vaccination bills are popping up in more than 15 states as lawmakers aim to potentially resurrect or create new religious exemptions from immunization mandates. They want to establish state-level vaccine injury databases, or dictate what providers must tell patients about the shots, which, if you think about it, a lot of what they're going to tell probably won't be accurate. Anyway, many people see a political opportunity to rewrite policies in their states after Trump's return to the White House and anti-vax activist Robert F. Kennedy Jr.'s nomination as the next Secretary of the Department of Health and Human Services. That agency oversees virtually every aspect of vaccination in the United States, from funding the development to establishing recommendations for medical providers to distributing vaccines and covering them through federal programs. Childhood vaccination rates against dangerous infections like measles and polio continue to fall nationwide, and the number of parents claiming non-medical exemptions so their kids don't get the required shots is rising. In 2024, whooping cough cases reached a decade high, and 16 measles outbreaks, the largest of them in Chicago and Minnesota, put health officials on edge. Most states are below the 95% vaccination threshold for kindergartners. That's the level needed to protect communities against measles outbreaks. It is worth pointing out that RFK Jr. went to Samoa not long ago and told residents there not to vaccinate for measles, mumps, and rubella. Many followed his advice, and many died as a result, according to Senator Schatz of Hawaii. There's a link to his report in the newsletter. I think if you look, it's 83 people died. Anyway, let's take an action. RFK Jr. is coming up for a confirmation vote in the Senate shortly. He poses a real and present danger to all of us. Call your senators and tell them that RFK Jr. poses a risk to public health. Let's use the phone because time is short. I have a link where you can just reach your elected officials. You just put in your address and it'll get you the phone number for them, or email, but go with the phone. Let's take an extra credit action. If there are kids in your sphere, make sure they're fully vaccinated. You love them, help them live. You know what? It doesn't matter what your age is. Make sure you're fully vaccinated. Let's talk about the National Institutes of Health and Trump. The Trump administration recently paused all communication from the National Institutes of Health. But here is the current state of affairs. Despite concerns about the future of research at the NIH, current clinical trials can continue as scheduled. The agency's acting director told staff scientists in an email Monday. The clarification followed what staffers called chaos last week when the Trump administration paused all communications from federal health agencies and suspended all government travel. The directive left NIH staff members with unanswered questions about their work and even whether they'd be able to continue caring for patients. The acting director, Dr. Matthew Memoli, a longtime infectious disease expert and flu vaccine researcher at NIH, wrote in an email that this was the case, that those trials can continue. Now, a copy of that email was obtained by NBC News, and in the newsletter you can find a link to their story on it. Now, clinical trials at NIH or NIH-funded institutions are ongoing, is what he wrote. Research participants can continue to participate in clinical trials at the NIH Clinical Center and at NIH-funded facilities. He also clarified that investigators could continue to spend money for supplies and pay for research participants to travel to the NIH Clinical Center in Bethesda, Maryland for treatment. The NIH conducts more than 1,000 clinical trials every year. This is a lot of people involved. Anyway, a staff scientist who wasn't authorized to speak publicly said that the email was good news, and it seemed to put things getting a little bit closer to normal, putting them back to closer to normal, at least for clinical work. Funding for any new projects, however, remains on hold. It is unclear whether the NIH will continue approving money for research grants through its review groups that are called study sections. Now, without the grants, scientists are unable to start any new research on conditions from asthma and pediatric cancer to COVID and Ebola. The NIH awards more than 60,000 grants every year, supporting at least 300,000 researchers. There's another wrinkle in all of this. Dr. Bhattacharya, a Stanford University professor, publicly criticized how the NIH was handling the COVID pandemic. And good news for nobody, he has been tapped by President Donald Trump to be the next NIH director, of course. There's no Senate hearing scheduled yet for a confirmation for Bhattacharya. The overall pause in external communications is supposed to end this Saturday or Sunday. But here's an action. We need to take this, because if we don't push back on Trump, he just wins, and he can't win. You got to tell senators not to confirm Trump nominees that are unfit. That's like all of them. Indivisible has a website that makes it easy to tell our senators not to confirm the most unfit of the Trump nominees. I'll have a link in the YouTube description box. It's also in the newsletter. You just click on the link and it'll open up and you'll see a picture of each of these nominees, and you can say call or email, click on either button, and there'll be a script for you. And I think they get your address if you want to email to make sure that they have the right senator for you. Anyway, please do it. It's really important. And it includes, of course, RFK Jr. again, do it again, Kash Patel, who wants to be at the FBI and turn it into a political weapon, Tulsi Gabbard, who is doing the work of Vladimir Putin. She wants to be director of national security. It's like Alice in the Looking Glass. Everything is just backwards. Anyway, as long as you're doing that, in your email or in your phone call, tell them that Dr. J. Bhattacharya is unfit to run the NIH because he opposed how the NIH handled the pandemic. Okay, that's what I've got for you today. Down below, you can like, share, subscribe, send me comments here or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.